I'm Lucas Dvoracek, and today I'd like to talk about our project on the reconstruction of calvarial defects complicated by infection, the effect of varying dosages of bone morphogenetic protein 2. This project was fully funded by the DoD and a firm. Large calvarial defects are a reconstructive challenge and do not heal spontaneously. Autologous bone is the gold standard for reconstruction, but 40% of the time, the original flap resorbs or becomes infected. Prosthetic alternatives spare a donor site, but have drawbacks including infection, extrusion, and cost. When these options fail, no good options exist to overcome the constraints of scarring of the defect site. One promising therapy which stimulates bone healing de novo is bone morphogenetic protein 2, or BMP2. It's already available in FDA-approved products for long bone and spinal fusion. One limit to using BMP2 is local and systemic toxicity, which can include heterotopic ossification, fertility problems, infections, and even malignancy. Our final goal is to develop an off-the-shelf, easily implantable product based on BMP2, which will stimulate de novo osseous regeneration in large calvarial bone defects, especially if scarred by infection and reconstructive failure, without exposing the patient to BMP2 toxicity. So one way to minimize the risk of toxicity and ensure only local effective action is the use of biopatterning technology. Like an inkjet printer, a bioink is applied to a substrate, allowing the quantity and the gradient of the bioink to be varied. We've previously generated biopattern constructs of BMP2 in a cellular dermal matrix, which is widely available, and we achieved approximately 30% healing in only 6 weeks, versus 15% healing in untreated controls. So we hypothesize that improved healing can be achieved with a higher dose while still remaining well below toxic levels. We've selected doses 2-fold, 10-fold, and 20-fold higher than our previous dose for this project. We employ a unique animal model to create previously infected, scarred calvarial defects. In New Zealand white rabbits, a cranial bone flap is incubated in Staph aureus to generate a local infection. The infection is allowed to propagate, and the surgical site is debrided and antibiotics are administered, after which the animals rest and heal. At this point, the calvarial defect site is no longer infected and scar tissue is formed, so the model is ready for experimental testing. Biopatterned BMP2 of varying dosages was then implanted, and the animals followed with serial CT scans out to 6 months postoperatively prior to sacrifice and histological and biomechanical evaluation. We saw a strong trend towards significantly more regeneration in the higher dose groups shown in red and green at early time points. By 6 months, although the highest dose still trends towards significantly more regeneration, these differences were not statistically significant. The trend towards healing in all groups seems to be continuing, and so with longer time points, we would expect there could be more regeneration. Animals did not demonstrate any evidence of toxicity or side effects from the higher dosages. And here are our representative initial defects on day 1 after placement of the biopattern BMP2 construct. And here we see the final defect size after 6 months, demonstrating the trend toward faster and more complete healing in the higher dose group. In summary, biopatterned BMP2 ADM constructs provide a promising off-the-shelf option for complex calvarial defect regeneration. Higher dosages may achieve faster and more complete healing while still being orders of magnitude lower than commercially available products. Further development of these constructs may provide a useful alternative for reconstruction of complex calvarial defects. Thank you.